All right. So welcome. It's Thursday morning, 10 a.m. And this is acupuncture for holistic pregnancy and powerful birth. I'm Kristin Hauser. And for those of you watching the recording, thank you for tuning in. And for those of you here, I'm excited to dive into this material together. And I'd really love to have your questions dropped into the comments or the chat, and I will check in with that when I can. It looks like we have a mix right now of people who are pregnant currently or in the birth field in some capacity, or both. So that's awesome. I'm glad that you're all here and we can really have like a deeper discussion about this. And I encourage you to minimize distractions if you can. I know that's not always possible, especially if you're a mother. You may feel like you have to tend to something else. Totally fine. Do what you need to do. And we will get started. So Kate says hello, also a midwifery student. Cool. Considering going back to school for TCM. 3-time mama. Okay, cool. Okay, so I'm going to share my screen with you. Give me just a moment to get that going. Okay. Okay. So if for some reason you can't see the screen, let me know so I can adjust that. I just want to pull up. There we go. All right. Okay, so everyone should be muted. If you could just keep yourself muted, I would appreciate it, just so there's not a lot of background noise or anything in the recording. And then if there are questions that you want to ask, like via audio, we can do that towards the end of the class. I will try to keep it to an hour just to respect everyone's time. And I could just keep talking about this for a long time, but I realize, like, we all have things to do and all of that. So let's go ahead and dive in. So a lot of you that are either here or watching the recording know me, but there's about half of you that signed up for this class. There's, I think, 45 people signed up. Half of you that signed up, maybe this is the first time you've taken a class with me, or you're not as familiar with my work. So I'm Kristin Hauser. I'm a licensed acupuncturist and herbalist in the state of California and also nationally in the US. I got started really in the yoga world and birth world. I was a certified birth doula at one point in time, and I attended births in the hospital setting and outside of the hospital setting before I had my own children. And then I got started really specifically working with women's health, fertility through postpartum, really from the beginning of my time working as an acupuncturist. And I've had my license since 2015. So yeah, I was just really diving into the birth world before I even got pregnant. And then it was just very clear to me from the beginning that I would birth as much outside of the system as I could, outside of the medicalized system. And so my first birth was a midwife attended home birth. It went beautifully and I had a really great experience overall. But during that pregnancy, I kind of really wrestled with prenatal care. And even though I really liked my midwife and I enjoyed our visits and all of that, sometimes I was just like, I'm not sure that this really is in integrity for me, because I'm not someone that goes to the doctor or gets sort of medical testing unless I feel truly within myself that there's a problem. So it kind of felt like I was being looked over or monitored in a way that I didn't feel particularly comfortable with. So yeah, my midwife for my first birth was a registered licensed midwife in the state of California. And although she was like the most sort of willing to go against regulations that I could find at the time, there was still this piece was like, we're kind of just following the medical model, but it's like not a doctor sort of thing. She was, it was totally cool. I didn't do a lot of the testing that was required or, and I opted out of a lot of things, but there's still something felt off. And towards the end of my pregnancy, when I realized that like she wouldn't attend if I went into labor before 37 weeks or if I carried past 42 weeks, and I was like, this isn't feeling good for me. So towards the end of that pregnancy, I started researching unassisted birth and kind of became more comfortable with that idea in the case that there were, some situation arose where she would not want to attend. And I knew that I would also not feel comfortable going to the hospital. So that was my sort of initiation into the unassisted community and free birth community. And then for my second, I just decided to go all in, and I managed my own prenatal care. And I just started asking more questions about what is true prenatal care? How do I want to take care of myself? Nothing really big shifted from the first to the second pregnancy. I was taking care of myself in very similar ways, but it was an internal state of my understanding of the responsibility I was taking for myself during that time that really did shift and change a lot for me from that point forward. So I went on to have a great free birth experience with my daughter. And yeah, I just am in this dialogue with what true prenatal care looks like. And I received acupuncture care and chiropractic care during both of my pregnancies. And just what I've seen clinically and from my own personal experience is just like it facilitates such a beautiful process of moving into the birth and motherhood initiation. So I just want to share that with people because I feel like, and we'll talk more about this in a moment, but I feel that we often see acupuncture being used for medical inductions or, reach presentation, and I'll address some of that as well. But it doesn't really speak to what acupuncture, really even without Chinese herbal medicine and all the other components of East Asian medicine, it can really address during this time. So I hope to share some of that today. Okay, so this is kind of the direction we're heading in today. So I'm going to talk a little bit about the basics, and it sounds like a lot of you kind of have an idea of what acupuncture is or does. I'll cover some of the basics. I don't want to spend too much time on that. And then I'll go back and kind of just what I was talking to is this misguided use of acupuncture in prenatal care today and how it's kind of just being commodified to serve the medical model. And we'll talk about what I've seen and what I try to strive to offer in my practice, which is acupuncture really is a tool to cultivate consciousness. And I'm in a particular lineage. One of my teachers that's had the most influence on me is Dr. Yvonne Farrell, and she's studied with Dr. Jeffrey Yuen. This is a Taoist tradition. And I'll speak a little bit more to that if you're curious. And then we'll talk about mother's health and baby's future health. And this is when I'll talk a little bit more about tongue ties and emotional regulation during pregnancy and how that might be having an effect on really the development of the baby's sort of nervous system and connective tissue realm. And yes, I may touch on MTHFR as well. So the myth of natural induction, again, acupuncture is often recommended for like helping get labor started or whatever nonsense that's all about. We'll go into that a little bit too. Okay, so let's start with just East Asian medicine is about a 5,000-year-old tradition from what we can tell. And it's really based on the observation of the natural world and how our bodies are interfacing with that and emerging from that. So there's this, of course, everyone knows sort of the yin yang symbol, and it is really about at its essence harmonizing this dynamic balance between yin and yang. And yin and yang have a very interdependent relationship, and we can understand the world around us and our physiology from understanding yin and yang at a deeper level. So yin is the dark part of the circle, and within yin there is the seed of yang, and yang is rising up here. the white aspect, and within that there is the seed of yin. So they only exist in relationship to each other, and they are constantly transforming one into the other. Pregnancy overall is a yin state, and yang is sort of that, when yang overtakes yin is when labor begins, and I'll share something about that a little bit later. In this tradition, it is just a radically different approach to the body system. So it's not so pathology focused. There is a deep understanding that vitality is something that's internally generated and in relationship with the environment, right? So it's like we're in this dynamic relationship with our environment, and we can use resources from our environment to internally generate vitality. So there is a lot of interdependence there as well. And as I said, so the focus is really not on searching for pathology, but rather for looking for patterns. And that's actually what we call certain diagnoses and ways of understanding the body. It's like, okay, this is the pattern that we're working with. It might be manifesting in a certain way, and that could be leading to some pathology and physiology or something else. But it is really just looking at patterns and understanding constitutional strengths and weaknesses, and knowing how to address that at a deeper level. Okay, so I kind of alluded to this at the beginning, but it's like, what is prenatal care? And I'd love to just pause here for a moment and really just kind of sitting with that question for yourself. Like, what does prenatal care look like? We've kind of been given this model through the medical system of like, you go once a month during this phase of your pregnancy, and then in the later phases you go more often, and you got to check your blood pressure, and you got to check your urine, and you need to have this anatomy scan to make sure everything's okay. And I kind of, to some degree, went along with that, thinking like, well, midwifery should offer like a more holistic approach. But then I was like, wait a second, this is just like all the stuff that the OB would do. It's just like in a cooler, more laid back environment. And like, I like this person more. So then, yeah, I just really, even during my first pregnancy, kind of dropped in and was like, what does that mean for me? Like, how do I take care of myself in my normal life? And also, how is this just an extension of normal existence? Like, I don't, if I'm not, I mean, even if I am having a problem with my period, I usually try to deal with it myself first. So yeah, I'm curious if anyone wants to share like what their experience is with this. Pull the chat open. Okay. So I just encourage everyone on this call who are listening to the recording just to be in inquiry about it, and be in inquiry about what prenatal care really could look like, and who's defining it. So we should all be sort of defining this for ourselves and for within our practices, if you are a birth support person in any capacity, and sort of taking back some aspect of community prenatal care, where women are caring for each other during pregnancies, and it's taking it kind of outside of that medical paradigm. And something else I wanted to touch on here is that from the East Asian medicine perspective, pregnancy is actually a state of almost excess, like abundance, because if you think about it, blood volume doubles during a healthy pregnancy, and there's excess hormones in the system, which you could kind of consider as chi. And it creates this real ripeness or state of physiology that is not pathologized or pathological in any way. It's just a different way to be in a female body. I'm going to pull up some notes just to make sure I'm not missing anything that I wanted to say.
Kristin, can you hear me?
Yes, I can.
I just wanted to add from your last question about prenatal care, because I just love this conversation so much. And I love the idea of community prenatal care, which, feels a little bit more difficult in our current times.
Totally.
But yeah, I'm almost 18 weeks pregnant with my third babe, studying to be a midwife. And I love my preceptor, who was my midwife for both my babies. And her prenatal care is so sweet. We have tea and you talk, and but it still is within the medical model of the schedule and the tests and whatnot. And she totally respects this pregnancy that I don't want to do any of that. But it's so interesting. I still have such resistance to like, I haven't established care with her yet, even though she's such a dear friend, because I'm in
Yeah.
an internal struggle right now of like not wanting any interventions, not wanting any ultrasounds, and just kind of like, yeah, redefining, like you're saying, what
Mhm.
is prenatal care, and what, even though there's a model, what do I need in this pregnancy
Yeah.
and moment, and figuring out how to honor that. So thank you.
Thanks for sharing. I think that's such a right place to be, and just being in that inquiry for yourself. And I mean, I just wish that um, more women could arrive in that place, because then it's like you are really assessing internally what you need, and not um, placing that responsibility upon someone else to determine what you need. So it is, yeah, and there's no necessarily right or wrong answer. It totally depends on your situation. If you already have a couple kids at home, so it just depends on where you're at in your life and your pregnancy. And yeah, I think it's a great inquiry to hold. So Kate says that's really helpful. The language around pregnancy that I've been exposed to has always been about depletion. Yeah, interesting, right? That pregnancy depletes the bones, the teeth, the energy stores, thyroid. Yeah, I think, it's interesting because I have to balance that certain things have been pathologized so much that we're just like totally over it, right? You're just like, oh my gosh, just let our bodies just be. Um, and, there is traditional wisdom that says like there are things foods you should eat and ways you should care for yourself during a pregnancy, so that is not the outcome. But I find focusing on it just is this shift in perspective. Essentially, it's like, okay, yes, those things are important, like we do need to care for the body and eat well and all of those things, but generally pregnancy is just like a normal part of life, and it doesn't have to be this thing that is super depleting or challenging. Okay, I'm just going to check in with my notes because I really don't want to miss anything. So something that I wanted to also touch on here is like these sort of core needs of pregnancy as I see them, as I've experienced them, and just what I see in the women that I work with. So it's like you need a lot of a lot of the similarities to what you need postpartum. It's like nutrient dense food, contact with nature to some extent. So being outside, being in communion with your environment, loving touch, so body work, touch from family members, that sort of thing. Meaningful relating, so relating with a partner, a friend, your other children, just feeling like you have a place in your society, in your community. I think that's really important. And then movement is a big one. So where rest would be like the biggest one, probably postpartum, I think actually movement is pretty important during pregnancy, because you have this excess blood and hormones, and we would say like this creates this condition of, it can create heat in the body, which is a healthy thing during a pregnancy. Like your temperature tends to be higher because of the progesterone. And this can create stagnation, and stagnation creates pain and issues. So just moving the body just courses chi through the body. And I think that can be really helpful during pregnancy. Okay. So I think I covered the rest. Let's go on to the next slide. So acupuncture is used a lot during pregnancy because, well, from my point of view, it's like you have these abundant resources. So the body actually has the capacity to respond and change a little bit quicker than it would in a non-pregnant state. So what I see clinically is women respond to treatments pretty quickly. Within 2 to 3 sessions, they're noticing bigger changes. And that's without making other changes, without adding herbs or doing something else. So that is my way of doing things, or my sort of what I see clinically. What I see within the larger community, and when I see people talking about acupuncture, or when I get questions or inquiries from people who are considering working with me, it's just a really misguided understanding, and it reflects this use of acupuncture to be in service to the medical model. So that looks like people calling me when they're 40 weeks pregnant and being like, I need to have acupuncture to induce labor right away. And I'm like, okay, let's hold on that for a minute and talk about this. But essentially, it's because the medical model or the allopathic model is really just about pathologizing what's normal. And then anything that the woman is maybe bringing that's like, hey, this is an issue for me, is like, okay, well, that's just a normal part of pregnancy. And so what I'm trying to do is say, like, hey, let's actually address your body needs, help you to feel good, and not pathologize all this other stuff that is not necessarily a problem. So a good example of that would be like low-lying placenta or placenta previa that's diagnosed like, I don't know, around 20 weeks, even before 20 weeks. And it's like, now this person needs to be monitored, or if they, if they consent to that and they are concerned, right? Even if they've had no other symptoms, no bleeding, no other issues, baby's doing great. So it's like, let's just stop for a minute and like, do we really need to have an intervention for this so-called problem, essentially? So that kind of leads me into the next one. It's like this hero medicine idea. It's like, well, Western medicine sort of told us that there's this problem, and now we're going to use acupuncture to like fix said problem. But first we have to ask ourselves, like, is this actually a problem? Like, what is the pattern present? What is this person showing me that their body needs support with right now? And that's always my orientation. It's like, okay, you can tell me this and that and the other thing, and that's fine if you think it's a problem. But still, I'm going to take my own assessment, use my eyes, my hands, and just support your body in this moment to what it needs and help you move through this issue, or move through whatever it is that you're going through. So I see that happening a lot. And one of my teachers teaches about like upper class medicine, middle class medicine, lower class medicine. And this comes from the classics in Chinese medicine texts. And so she says, or according to like this ancient text, it says upper class medicine nourishes destiny and corresponds to heaven. Middle class medicine prevents illness and corresponds to man. And lower class medicine treats illness and corresponds with earth. So it's creating this hierarchy. And it's not to say that one is necessarily better than the other. I mean, all can have a place. But generally speaking, I am trying to orient more towards middle to higher class medicine, right? So this particular teacher, Dr. Farrell, she calls labor induction, like using acupuncture, as lower class medicine. I kind of consider that like lower than lower class medicine, because in lower class medicine, at least you're sort of addressing some illness. But with induction, it's like you're not really necessarily addressing anything besides the pathology of the entire medical system, or trying to fit into that model. If you have any questions about that, let me know. I think I'll go ahead and move on to the next slide so we can get into some more of the sort of juicy territory, which is what I like to talk about. And that's how I see that acupuncture can be used for a holistic pregnancy, for creating a more powerful birth experience. And that's really about cultivating consciousness, both within the mother and the baby. And this doesn't mean not addressing physical challenges that come up. We all know that like pregnancy brings so many changes in the physical body, whether that's, from the start, fatigue, nausea, anything that comes up. There are, ways to support that through acupuncture. And at the same time, it's like really about the deeper psycho-emotional and spiritual journey through pregnancy and that transformation into motherhood, whether it's your first time, your fifth time, whatever. And I've just found that that's where acupuncture can really like come in and be a supportive tool and help women to get out of that model of thinking that's like they need to follow every guideline for their prenatal care. And there's just so many options for the prenatal experience or the pregnancy experience. it could, it could look different for everyone. And this is just one tool that you might want to add in. So let's look at like through the trimesters. Wish I could. So as I was saying before, pregnancy is really a yin state, right? It's this place where you have more body fluids through the amniotic fluid, you have more blood, you have more chi, you're gaining weight, so you're just more dense. And the first trimester is really like that initiation into a yin state. So it is like this reorientation towards the internal environment. You're creating more boundaries, possibly within your external environment. You may be needing to rest more or spend more time away from technology. I know that's been a big one for me during my pregnancies. It's like, I just can't, like, I just don't want to look at a screen, don't want to be like plugged into Wi-Fi and all of that kind of stuff. So it's a profound change from our generally young oriented society or culture that prioritizes productivity and visibility, changes that happen externally. And during the first trimester, it's like, yeah, if it's your second or third pregnancy, like your belly's probably changing and growing, but it might not be as obvious to the outer world. And I know that can be a struggle or just a time where it's more intense. So what I tend to focus on like during that phase of pregnancy, unless someone has like previous losses that they're working through or other underlying health challenges like thyroid or something else, is just helping their body transition to a more yin state of being and slowing down and orienting more towards rest if needed, and just, yeah, addressing that phase of coming into the pregnancy and just being like, okay, we're here, this is what's happening, and going from there. Just gonna check in something. Yeah, so Rachel says taking care of ourselves is always important. And of course, it carries over to the pregnancy. Yeah, just like taking responsibility for your health overall. So there's like an archetypal journey to pregnancy in a way. And within acupuncture, so if we talk a little bit about acupuncture here, it's like we have the 12 primary meridians that correspond to different organ systems. And those you learn a lot about in school. And then there's this system called the 8 extras, the 8 extraordinary meridians, and they have a relationship to how you utilize your resources over the course of your lifetime. And also they store resources for you. So it's almost has a connection to like genetic material and epigenetics and what's called in Chinese medicine Jing, which is essence. So it's like how your essence is used over time and how it unfolds. And a lot of your essence goes into a pregnancy, into creating new life. And how that unfolds through the course of your pregnancy and birth and postpartum can really be supported through the use of acupuncture. So I tend to use this 8 extra system a lot more during this phase. I mean, yeah, that just tends to be what I use anyways, but especially during pregnancy and towards the birthing time, because it can address so many different things sort of simultaneously, and it has like roots in what my teacher, Dr. Farrell, calls like your curriculum. So your destiny, your karma, however you want to, whatever term you want to use to relate to that, it has a deep connection to that place. So that's what I tend to sort of use throughout prenatal care. So if we move towards the second trimester, then it's like a visibility and growth stage. A lot of women feel better, generally speaking, during this time. And there's this sort of two things going on. It's like you're feeling more grounded in the pregnancy and feeling like, okay, it's really happening. Like I feel my baby moving. And then you're also orienting towards what's to come. So the birthing portal, you may feel like you're getting closer. It may still feel far away. You maybe start making more decisions towards that place. And then in the third trimester, it's again about sort of going back inside, disengaging with the external environment. And because you're sort of in this in-between phase, especially in the final weeks of pregnancy, it's like your boundaries are sort of more open and porous, and you need some level of protection from others and from self. So ways to like navigate your energy resources and be sure you're not having too much external influence. So what I see for women during this time that are in traditional prenatal care is like, it is just a shitstorm, to tell you the truth. It is like, the testing starts to ramp up, and it's so rare where it's like someone is not having to have extra scans of some sort, like extra ultrasounds, extra fetal monitoring, stress tests, all of that. It's like so rare that I see that that's just like not a thing. And then you have like baby's position that women might be concerned about, timing of the birth. Like, am I going to go past 42 weeks? So there's lots of fears that can start to come up during this time. And it's like, if you're in traditional sort of allopathic prenatal care, it's a lose-lose situation. Like you're just getting these fears sort of placed into your orbit or into your system, and at a time where you're already more open and porous and like needing more, and you're disconnecting from your rational mind anyways. So I see that as actually creating a lot of problems, generally speaking. It just creates stagnation. It creates like Shen disturbance. So in Chinese medicine, the heart is the seat of the mind, or what's called the Shen. And the Shen becomes like a little more easily disturbed towards the end of pregnancy. And I think that's like a normal thing. But it doesn't help when the prenatal care that you are receiving is like contributing to that. And then we have this whole layer with like the nervous system coming in and getting more highly activated. And it just is a really tricky thing for women to navigate if they are fully in that model. Yeah. So I wanted to also speak to on this slide about just what I see like through each trimester on the physical body level. So I was just discussing like psycho-emotionally what's going on, archetypally, spiritually, how women move through a pregnancy. But there's also this point I was speaking to earlier about that OBs or whoever you may be seeing is like often just kind of dismissive towards digestive complaints, heartburn, constipation, like things that can come up that actually have solutions that aren't like taking some medication. Yeah, so during the first trimester, that is like nausea, vomiting, morning sickness, fatigue, insomnia, I see a lot, or constipation. Those are probably like the top things that I see that have pretty easy, like effective ways to manage them that like aren't taking Colace, for example, which is like for constipation. And I see that often. Okay, in the second trimester, because that's when blood volume has fully expanded or should be fully expanded, you can see more issues with just pain. So just that increase in blood volume and sort of triggers potential stagnation because you just have more moving around. And if it's, if you're not getting the movement in that you need or whatever the case may be, you have some underlying like muscle imbalances in the pelvic floor or whatever, then you could get round ligament pain. The baby's growing at a quicker rate, back pain, hip pain, those sorts of things, knee pain even, headaches with the blood volume expansion can happen in this time, heartburn can increase. So again, these are all things that have sort of ways to work with them and approach them. Third trimester is when I see like wrist pain. If there's any swelling or edema, we might address that with some dietary changes and acupuncture. What else is there? Insomnia can come back, or just like digestive changes overall. There's something else I wanted to mention. Oh, like, so some that I see that like people come into me for is like Iugr, so some growth restriction or perceived growth restriction. That's just a very interesting one, right? Because then we get into like getting more testing and seeing if the baby grows and watching the percentile change and all of that. And I just think that's like crazy making. And if the mother feels that there's a true issue with growth or notices something, really that's rooted in like a kidney issue or a Jing issue. So yeah, there's that's like a whole nother class basically. But just to know that sometimes if there is perceived issues that are brought up through medicalized care, that often don't have solutions. Like they're like, yeah, this problem is going on, but there's nothing we can do about it. Just do more testing and then maybe take the baby out earlier. So I don't think that's like a good solution, or it just increases anxiety. It just creates a lot of internal chaos from what I've seen. And that might be a case where I would use herbs. So we could, have a whole discussion about that. But just to recognize that, like, yeah, things can really come up during pregnancy. I'm not saying that everyone will have these easy, problem-free pregnancies without any issues, but there's just a whole other way to go about it where it's like, let's address what's here, what's present, and see how we can shift things like internally from a different space. Okay, I'm going to pause for a moment. Any questions about that? Next, we are going to talk about the tongue tie and just overall emotional regulation during pregnancy. Okay, I'm just going to keep going. Okay. Okay, let me see what Kate said. I do have thoughts about breech presentation, and I can just speak to that right now because I don't have a slide on it or anything. So it's said in classical texts that breech presentation is a sign of kidney deficiency. So it's a sign of kidney deficiency. I personally don't think that means that we have to intervene. I don't think that means that it's not possible to birth normally. I do consider it like a variation of normal. And at the same time, I can take into consideration that according to classical and ancient Chinese medicine, it is a sign of an underlying kidney issue. If you know anything about East Asian medicine, or and some of you do, you know that kidney issues, like, these are constitutional things, and it's not something you change in a week or two. If it's causing you other problems in your life, that's something you could address over the course of 6 months to a year, to be realistic. It's not something that you can change in 1 to 2 weeks, 3 weeks time. So yeah, I don't know what else to really say about that. Like, if someone comes to me with like breech presentation, I kind of talk about that. I talk about my perspective on it. And if they're in the medical model and it's like they're going to have a C-section or do all the things, right? The chiropractic care, the spinning babies technique, the acupuncture and all of that. Then I just instruct them on like, sort of like, I'll do a treatment and I'll instruct them on how to do moxibustion at home. And from my understanding of that treatment methodology, the baby's not going to move if the baby doesn't want to move. That's the way I look at it. If the baby's position needs to be in that position for a certain reason, then it's just going to stay in that position. And that's totally fine. If the baby was going to turn anyways, or is able to turn, then, you know, maybe does the moxibustion possibly help it along, or chiropractic care, or whatever else? Yeah, possibly. It's not a huge part of my practice. Like, I do get cases, maybe 5 a year, I would say right now. So I don't know if it's really, gets more into the discussion of like what's an intervention and what's not. Supporting the body to rectify itself, or to like organize itself in a way that's best, for me, is more like supporting the unfolding of Jane. So I don't think I consider like doing moxibustion on UB67 an intervention, because I don't think the baby's going to move if the baby doesn't want to move. So I think that's, if you have any other questions on that, let me know. Do you have a general flow of care that you recommend? Like, how often? Yeah, so that's usually individual, but generally speaking, like if there's no areas of concern, like they're doing well, they're feeling pretty good, then I would say like twice a month, maybe in the first few trimesters. Usually there's something in the first trimester that like weekly seems to be more supportive. And then towards the end, weekly, from about 34 weeks on. There's just so many changes that happen during that time. And there's so much psycho-emotional sort of shifts and things to move through that I find weekly is really helpful during that time. And the women that I work with that come in weekly, from probably 34 weeks on, tend to go on to have like more easeful and joyful births. I think I don't know. There's research about that. I'm not going to go into that here necessarily. But there are acupuncturists that do a lot of research in this area, kind of showing like how getting regular acupuncture before birth that's not induction related can just support easeful birth. Maybe I'll talk about that in a minute when I talk about induction. Okay. Oh yes, you were on a call with Deborah Betts yesterday. Yeah, her book is really great, and I also have some issues with it, just because it's like, I just wish it was not so medical model oriented, because she has so much to offer, and I've definitely learned from her, and I've even used her protocol, or a variation of her like labor prep protocol, because I think it's great. Like it makes sense to me. I usually combine it with some 8 extra things. But yeah, she's really great. Okay, so mother's health during the pregnancy and baby's future health. So in the ancient text, there is a big focus on emotional regulation during pregnancy, and being sure that the mother, is supported and also is able to be in a more relaxed yin state. That is very tough to do in our modern society. But I think there are still things we can do just to support overall, like not getting too worked up, essentially. So whether that's through like nervous system support or acupuncture or other things, just knowing how your system works and supporting yourself to let go of stress and process what you're going through, and just let emotions move through you rather than getting sort of stuck in any kind of emotional pattern. And this relates to the heart. So as I was saying earlier, the heart in Chinese medicine houses the Shen, and the Shen is sort of your mind, and also like can be tied into like your emotional state. So what's interesting is the heart is said to sort of open into the tongue, has a relationship with the tongue. And tongue, if you look at your own tongue and you see, like some people, I have it actually, I don't think it would show, like it wouldn't be very clear if I showed you right now, but I have a midline sort of crack, or it's a reflection of that midline defect of a line that goes down the middle of the tongue. It's very faint. It can be at the tip of the tongue as well. And that has a relationship to emotional regulation, both my capacity for it, but also what I received from my prenatal experience, right? So what I think is going on, like with, or what I think one aspect of tongue ties is this emotional regulation component, and how the mother is supported during her pregnancy, and also able to receive emotional support, process emotions, and be in a state that is more, emotionally resolved and not a higher stress kind of state. So I think that passes along to the baby. And there is, of course, this, like, I do think if you have MTHFR, like this genetic variation of how you process folate, I think that also plays a role. But interestingly enough, like I took a lot of methylfolate in my first pregnancy, and not a lot, but like a moderate amount. And my son had a pretty severe tongue tie. And in my second, I didn't really take as much. I took it sometimes, but like just not as consistently. And my daughter did not have that. So there's just more to it than that from my point of view. And I do think like providing this emotional support, or however the woman needs to receive that, can really make a difference. Yeah, I'm not sure, Michelle, I'd love to know if you have any other questions or comments or anything you want to add about that before we move on. Take a drink. So yeah, all that to say that like mother's heart state or state of Shen during the pregnancy sort of has that impact on the prenatal experience of the baby. And that can come through. And I think that can show up in tongue tie. Because even if we think of like, what's the correlation we make with like that person's tongue tied, or yeah, there's just a relationship there to expression and emotional regulation. Okay. So we'll end by talking about moving more towards the birth portal and just the myth of natural induction. And this is like an area where it's like you'll see in a lot of modern acupuncture texts about pregnancy, like they just speak to induction like it's just like a totally normal thing. But I challenged actually a panel of like Deborah Betts and like a few other women who are practitioners of Chinese medicine and working with pregnancy. And I just said, like, where in the classical text is it talking about this? Like, where is it saying that, you should do an induction after X amount of weeks? And it's definitely not, obviously. From the East Asian lens, like if you look back in classical texts, like you would not want to interfere with the birth time of a child. That is just a very auspicious thing. And it's not something that you would not want to interfere with destiny in that way. However, with that said, there would be ways to support the pregnant mother as she approaches birth, whether that was through food, receiving acupuncture treatment, herbs. Herbs are like super commonly used at this phase of pregnancy classically. So it's not about like, there's nowhere in ancient texts where you can say like after 43 weeks or whatever. They talk more in lunar cycles. So yeah, it's more in that kind of frame of reference as to what's happening. And I think we've really done ourselves a disservice by like kind of opting in and buying into this induction model and being like, well, acupuncture can help. Well, yeah, it can, I guess, but like, what's the cost? Because there's always a risk associated with any intervention. And just hitting the body with all these contraindicated points for pregnancy and trying to sort of create a labor pattern, that's really no different than using Pitocin or another induction method from my point of view. It still comes with risk. I've seen that happen where it's like, sure, you get like a really intense labor induction treatment with e-stim and like labor starts, but then maybe it's like your body's not ready. So it just like kind of goes down again. And that in itself is like kind of exhausting for the body. It has like this whole emotional and psychological component to it. So that's why I just don't really do those kind of treatments, because they come with, it is like an intervention that comes with a risk, right? All interventions have risks. Okay. So it said, it seems like a lot, it's from Hilly, seems like a lot comes down to language, word choice, and that treatment effect largely relates to intention. Yes, intention is super important. What the intent of the treatment is has to be like at the forefront of your consciousness, of your mind, whether you're receiving or giving the treatment, essentially. So that's true if you come in for acupuncture care, then you, on that end, like when I was working with a practitioner during my own pregnancies, I just had to be upfront and I was like, look, this is not the kind of care that I like towards, especially towards the end of my pregnancies. I'm like, I don't want an induction treatment. I want you to address what you see based on your assessment of my tongue and pulse and what you think is beneficial, and treat me based on that. And that's it. So it's the intention, both from the, as the patient or as the client and as the practitioner, I think that really does matter and it makes a difference. And yeah, when someone comes in or approaches me and they're like 40 weeks, they've never had acupuncture before, they're trying to avoid a medical induction. It's like, it's a tough spot as a practitioner. It's a really tough place to be in. Usually I try to focus on mitigating the anxiety that comes with that internalized pressure, to be honest. So going back to this idea of intention, it's about like, is our intention to intervene and try to be like this savior hero type medicine? Or is it just to be like, okay, this is what's happening and this is how I can support the unfolding of this process for you in this moment? Obviously, on my end, I'm definitely orienting towards just letting this be an unfolding. I think I already addressed that traditional auspicious nature of birth timing. I'm just going to check in with my notes one more time. Okay. So birth is really an initiation. And I love this quote. I think it's taken from the classics. Labor begins when yang chases away excess yin. Qi pushes the blood. The door of the uterus opens. Then if qi is correct and blood circulates well, labor will be harmonious. So it's just, again, this radically different orientation towards what needs to be happening around the time that someone enters the birth portal. And it changes how you approach preparing for it too. Because for me, in those final weeks of pregnancy, both for myself, if I'm like just caring for myself or working with someone else, it's just about regulating the nervous system, allowing the nervous system to drop into different states of being, supporting the like harmonizing yin and yang. I mean, that's at the root of what acupuncture does, according to East Asian medicine, is it harmonizes yin and yang. It moves qi and blood, and it rids the meridians of any pathogenic factors. So that, again, is the focus. And when you do that, it's like the body can just organize itself and knows what to do. Essentially, I don't have to do anything like extra for that to happen. And yeah, this class, I'm not really going to talk about like acupuncture use during the birthing process. Although I think that's something I would do if I felt like I was in a tough spot. I haven't needed that during either of my births, but I have seen it used. I've used it for other women during their birthing process if they wanted that. And I've seen it to be useful. If you have any more questions about that, let me know. So the question is really like, where do we go from here? So whether you're pregnant, you're an acupuncturist, you're a birth worker of some kind, maintaining that question, I think that we discussed in the beginning about what true prenatal care is just a good place to start and really be focused on, if you're pregnant, getting the care that you need, that you feel like you need, and orienting to care that is less pathology centered, and just really getting into defining holistic care for yourself. That looks a lot of different ways. That's like eating really good food, taking walks, maybe getting chiropractic care or some other type of body work, receiving acupuncture, therapy. I mean, there's all kinds of ways. It doesn't have to be a certain thing. Also, interweaved with that is like this concept of really relating to your own power in an embodied way. And that is just a really important, I think, an important thing to do as you prepare to birth. Not everyone does that, and that's okay. That's really okay. I'm not here to change anyone's mind or make anyone do things that they're not comfortable with. And I see that in some of the clients that I work with as well. It's just like, they're not interested in that, and that's fine. They're going to have, their experience, and I'm not responsible for their experience of them going into the hospital and doing X, Y, and Z. It's not my responsibility. So yeah, I think that covers what I wanted to say today. I'm like super on time today, which is great. It's 11 right now. I'd love to take some questions. This is just a way to stay in touch with me. There's no, I'm not pitching a new offering or anything like that right now. I'm just grateful to share this information with other people who are interested and have a discussion if anyone wants to add anything. And yeah, we'll go from there. So if you have questions, I'll open that up now. If you want to unmute yourself, you can, or you can just type into the chat. Okay. Do you have success with hyperemesis? Yes, I would say for that question, yeah, I have seen that. I have seen success with hyperemesis, but I think you have to sort of, it's too late if someone comes in and they're like, I've had it for 20 weeks already. Ideally, you want to really get that started from the beginning. And I use herbs in those cases, whether that be a combination of some Western or mostly Chinese herbs. But it is a tougher to treat condition for sure. For sure. Do you think it's more often a state of mind or deficiency? I think there's an emotional Shen component to it. There can definitely be that sort of component to it, but I also, I tend not to go into like black and white thinking, and I'm not saying that that's what you're doing here, but I think it depends. I don't think there's one one pattern that corresponds with hyperemesis. I think you just have to see what the pattern is in front of you and address that pattern. So it could be a state of severe chi stagnation and the liver causing the stomach to have all kind of issues. Or it could be like a real inner earth deficiency or spleen stomach axis deficiency. I love the concept of tongue-tied and emotional regulation. Yeah, it's interesting. Do you connect the timing of baby's arrival with emotions as well? Not as much, to be honest. I know that can happen. Emotional stagnation can get in the way of the beginning of the labor process, but I don't see certain common patterns. You know what? I take that. So the common pattern I see that causes longer pregnancies is probably phlegm and damp accumulation. If you have a phlegm and damp accumulation issue, it's just harder for yang to overcome yin, essentially. So that's where I see like later or longer pregnancies. And stubborn sort of pregnancies. Yeah, you see a lot of damp and because of where you are located. Yeah, totally. Okay, thanks, Rachel. Take care. I hope you have a great pregnancy. Yeah, okay. So if anyone else wants to stay on, I'll stay for another minute or two. Okay, yeah. So this is also a good point. So Hilly said that going late seems even more common during the past year, and it makes me wonder about the state of the world and reluctancy. Yeah, it's like this world is like totally in chaos. So it makes sense that mothers would be more reluctant to birth their babies, especially if they're birthing in a hospital. That has been just a wild thing for me to even consider. It's hard for me to understand, I guess, that process right now. Like that so many women are still opting into that environment when there's risk of your baby being removed from you. It's baffling to me, honestly. It's a hard thing for me to think about. And maybe that's because I'm already removed myself from that system, and I would just not enter that system unless I really thought there was a major issue that they could help me with. So it is challenging right now for sure. And I do think right now, specifically because of that, the emotional stagnation could be playing a role for longer birth or longer gestations, which is adaptive, right? So is it even pathological? It's adaptive to your environment to not want to birth your baby right now, especially in a hospital. So again, I see that as almost a sign of resilience within your own system. If your system has the intelligence to hold a little bit longer to ensure safety for everyone involved. Okay, yeah. Kate says, on that note, I've heard midwives speak to more miscarriage and general complications. Totally makes sense. And I would say I have seen that to a certain extent. I've seen that with infertility as well, as just an increase in like bodies being adaptive in the sense that like maybe right now is not the best time to conceive. It doesn't seem like this is a safe world. And it also depends on your own orientation to safety and how you source safety within yourself and within your environment and what your experience has been over the past year. We're not all having the same experience. I can assure you that. There's a wide variety of what's happening right now. Yeah. So Hilly says, I've heard stories of mamas not being able to take off their mask, even when the baby's heart rate was not assuring. Yeah. I mean, again, to me, this is just like insane. It takes words like away from me. I'm just like, this yeah, I don't know. I don't know what to say about that. It's terrible. It's really terrible. Rachel says, thank you. Loved listening to all your info. Yeah, especially the discussion on natural induction. Thanks for joining. Nothing natural about induction. Yeah, you're welcome, Kate. I hope you continue to study and do this work. All right, so I'm going to stop that. I'm glad you'll take these ideas forward. Thank you all for staying on. And if you're watching the recording, I appreciate that as well. Thanks for being here. If you have questions, please reach out to me. If you're looking for a practitioner to work with, you can also reach out to me and let me know. I may know someone in your area. And I hope you all have like a beautiful rest of your day. All right, take care.